arth refers to joint, and many of you would be familiar with arthroscopy, the scoping of the joint, if you've had a knee surgery or a shoulder surgery, right? So arth or arthro is joint, and of course itis is inflammation. So we can have inflammation many places in the body. Oftentimes we think of inflammation or itis besides arthritis, appendicitis, gastritis, having to do with the stomach. All of those itises are inflammations. Okay, different people experience inflammation throughout the system, but tonight we're specifically speaking about joint inflammation. So first of all, let's differentiate arthritis. And we'll start by looking at the hand, because the hand gives us a quick reference just by location as to the type of arthritis that we're dealing with, and most commonly then what we would be looking for as far as a treatment. Well, let's look at diagnosis first, and then we'll talk about treatment. So if we look at the hand from the back of the hand, the joints are divided based on the bones that are associated with them. So the bones in the hand itself are called the metacarpals. The small bones, which there are 8 of in the wrist, of course these are called the carpals, and you're familiar with the carpal tunnel. These are the carpals. On the thumb side of the wrist and the arm is the radius, and on the opposite side is the ulna. So when we look out here at the hands, the backs of the hands, there are small joints in the hands themselves, and these joints or the fingers themselves are called phalanges. When we look at the phalanges, there's going to be a distal phalangeal joint, interphalangeal joint, or dips. So these are just under the nails. And then the finger joints here are known as the proximal interphalangeal joints. We call those pips. And these are the metacarpal phalangeal joints in here. So where these come up like little chicken bones, they actually articulate then with these interphalangeal joints. So these are the little, let's see, joints that we'll see out here in the fingers. Okay? So as we look at this, what we're really looking for then is the identification for location of specific type of arthritis. If you have inflammation or joint deformation in the distal interphalangeal joints, we're going to call that osteoarthritis. If you have them in the MCPs, the metacarpal phalangeal joints, so these fighting knuckles, okay, the MCPs, and here between the ulna and the carpal bones, this is most often associated with the autoimmune type disease called RA, rheumatoid arthritis. Okay, and usually that will be bilateral.
Is that the one that has the great big humps on it?
And it'll be very lumpy.
Okay. It's bilateral?
Bilateral on both sides.
Oh, done.
Okay?
Okay.
So unilateral would be one side, bilateral is both sides. And so when we look at that, they're very commonly bilateral. So these rounded off joints here, like this, and then these chicken bones coming up in like this. Okay. Now, when we look at the X-ray, most often what we'll see is an inflammation of this joint that will actually start to look very destroyed. Okay? Meaning osteoarthritis will be a degenerative process to where then this joint will have damage to it, and the damage will be typically a thinning of the joint space. So underneath that fingernail, if we just look the anatomy of the bone of the finger, let's just take this out this way. The fingernail would be like this. Underneath that fingernail, what you'll see is that this bone that comes out into the end of the finger, this joint space will be narrowed. And that's usually what you'll start to see with the osteoarthritis. And there will be a deformation with that. Whereas the rheumatoid, if we were to take this joint and enlarge it, what you'll see is the joint space is being attacked by the immune system, and specifically here at the synovial joint membranes. And so you'll start to see what are called joint mice. These will actually look like little mouse ears, and it'll start to erode the joint out this way. You'll start to see these erosions like this. Okay? So it's very erosive, and that's why you get the nodules associated with the rheumatoid arthritis, and you'll start to see these large, inflamed, destructive type mounds, okay, because the bones are actually being chewed up by the immune system, and you start to get this erosive appearance. Okay. Now the next one we'll look at, is everybody okay to that point? The next thing that we'll look at is when the joint, or excuse me, the whole digit becomes very, very swollen. So this middle finger now is very swollen. Okay? That whole, you see all the fingers are nice and uniform, and then you see this, what we call a sausage digit. This is the arthritis associated with gout. And gout is the depositing of uric acid in the joint and causes inflammation of the entire digit. You'll see gout most commonly in the big toe of the foot. Okay? So in the foot, you'll see how the foot comes down, and then out comes the big toe like this. And this joint right here will become very inflamed, and then the toe itself will get very inflamed. Okay? So we look for this, and this is different than the bunion, because you'll see red inflammation, and it'll be very, very, very sore, and then the whole digit itself will start to become inflamed as well, and it's very difficult and painful to walk because of the swelling of this joint. Okay? Again, different than a bunion, and also different than for the student athlete who gets sensitivity underneath the toe in the sesamoid bones called turf toe. Underneath that toe there's a large tendon that comes down underneath the foot and causes flexion of this toe, or drawing down so he can actually push off. And what happens underneath, if we're to turn this now on its edge, is that this tendon actually comes down through between two small kneecaps. And those little kneecaps, in essence, protect that tendon. And when they keep hitting on the turf, these little bones will actually push toward the outside and start to change the angle of pull on that tendon. And it becomes very, very sensitive. So they'll get what's called turf toe. Okay? And that's really, we found it to be a pretty easy correction just by doing a tape job for that and then strengthening this muscle back in the foot. But gout then is a very commonly caused by an elevation of uric acid, and the uric acid starts to deposit or crystallize out in the body. Very commonly associated with overconsumption of red meats and excessive consumption of caffeine and coffee. Okay, so we'll see that a lot with people who are currently experiencing that. Also, high dairy consumption. The interesting thing is with gout, they've shown in some research studies, low-fat dairy can be something that can actually help to reduce uric acid levels. Okay, and then of course the amount of red meats that they consume, and then improving kidney health.